Good morning, Kern County, and welcome to another episode of Kern Living. I'm your host, Ryan Nelson, and today we are talking about health, and health specifically with kids, and I have Dr. Hughes from Omni Family Health with us. How are you?
I'm doing great today. Thanks for having me.
Well, I'm glad you're here because I'm sure there's a lot of parents out here that need to know about what Omni Family Health is and the services that you have for our kids in our community.
So as a pediatrician with Omni, we've got all the services we do from birth until through 18, but then even after that, because we've got family practice providers even after that. So we do vision and hearing, we can do blood work, we can do hemoglobin, lead checks, EKGs, everything that you would need really under one roof, which is why I love working for Omni.
And that's awesome. And I know that school's about to start up again, and I know kids are like, oh my gosh, but parents are happy, but also what comes with that is getting physicals. Now, why is it important for parents to get their kids a physical before school starts again?
So not everybody has to have a back to school physical per se, just the kids that are due for vaccines or they need other forms done. They've got their allergy forms or their sports forms, or they need vaccines. So those are gonna be usually your kindergartners the first time they go into school, or if you've changed school districts, as well as kids that are 11 years old. And so they come in, and then you need your annual physical anyway. So that can be done any time of the year, but that's what we use for the back to school physicals. And depending on the age of the child will depend on what we're doing for them that day. So we're making sure they get their age appropriate vaccines. We're making sure we do the sports physical if that's what's needed and anything related to that.
If a kid is watching right now and they're kind of scared to come to the doctor, how can you keep them calm and happy about their visit?
Letting them know that it's okay, that we just want to make sure that they're healthy. The doctor's going to tell you everything that they're doing and walk them through. For the parents watching, I would not talk to them about vaccines because if they think about that for a long time before coming in, they'll get more anxious, and then it is harder for them and harder for us to have a conversation. So that can happen at the end of the visit. At least that's how I like to practice. I let the parent know how many vaccines, how many pokes, and that way the child doesn't have to think about it for a long time.
Right. Now, when it comes to COVID vaccines, should parents get their child vaccinated before school starts?
Absolutely, absolutely. We do now carry vaccines for kids ages 6 months and up. Even if they've had COVID, they should still get it. It is definitely high and rising right now. And we want to do everything we can to use these safe and effective vaccines to keep them in school, to prevent missing school and being sent home.
Well, thank you so much for all of the information that you just gave us. There's a phone number on the screen right there that you can call if you want to get your child a physical before school starts. So please don't wait until the last minute. Thank you so much, Dr. Hughes, for joining us today.
You're welcome. Glad to be here.
And make sure you follow us on Instagram at Kern Living and myself at Ryan Nelson 23, and I will see you next time.